achieving a successful healthcare financing system continues to elude Nigeria, as the budgetary allocation for health is still below the 15% signed by the Nigerian government in the Abuja Declaration. And so, not surprisingly, our healthcare system has been described as one of the weakest in the world, as it operates under no clear guidelines. Thus, with this low funding, it is not surprising that we are expecting to fall short of meeting the MDG Goal 4 on reduced child mortality and Goal 5 on reduced maternal mortality. And there is, of course, a limit to which international organizations can assist us. The great healthcare challenge for us has been that of providing a primary healthcare program that holistically works for the nation as a whole. And a national commission for this purpose has apparently already been set up. According to the report, the commission has equipped 200 federal sponsored clinics for its program. And in a study on barriers to use of primary healthcare in a low-income setting in Nigeria, it shows that even though these primary healthcare facilities are available, it is poorly used and utilized because of lack of essential drugs, high cost of services, and inadequate infrastructure in place. But the truth of the matter is that the federal government has no business in running a clinic anywhere. What they should concern themselves with is funding adequately the healthcare sector, as well as oversighting the healthcare sector. These are matters which can be taken care of, which cannot be taken care of in 200 federal clinics, because they would definitely be overwhelmed by trying to run it on a day-to-day basis. What is going on at this moment is that the federal government is a federal government usurpation of state or local council duties for political purposes. And these days, a state government retaliation usurpation, where most states of the federation now own and run tertiary hospitals. First, we have consequences which translate to inefficient provisions of resources and management, which lead to overcrowding, long waiting times, stockouts of essential drug supplies, client dissatisfaction, frustrated, dissatisfied, overworked healthcare workers, and no wonder they are all emigrating out of the country, and increased risk of adverse events to these patients, which we'll see later. Now, this is a typical facility infrastructure in Nigeria, a legacy of poor funding of health plus poor maintenance, culture, and management. Praise the Lord. Please, what happened to the men? Are you able to appreciate the distortion? Inadequate priority to public health. Now, when we talk about health, we are not, some people just believe it's when somebody is sick, then you're treat the person. But of course, prevention is very key. And prevention runs across interventions that have to do directly with the health itself and those that have to do indirectly with the health. For instance, there has to be water available. Running water for that matter, adequate water, clean water. All these have their implications for infectious diseases and infestations with different organisms in the country. We are being told for Ebola that we should wash our hands with running water. The mind boggles if you cannot find running water in the hospitals. where would you find running water in the country? And how will the rural dweller be able to wash their hands after utilizing the toilets? Where will they wash their hands? And then, of course, we can then appreciate how the Ebola virus will clearly wipe out this nation. So most of the patients currently being managed in Ebola are in an infectious disease hospital in Yaba. And in all the rest of the country, like in Port Harcourt now, there is Ebola. It means that we should have been proactive in anticipating and realizing that there is a need to put in place such facilities that are meant to take care of disease entities like this. Now, however, if the reason behind Nigeria's poor healthcare system could be attributed to only poor funding alone, the solution to right the system would have been a piece of cake. Unfortunately, this is not so. There is lack of logistic management skills that have led to frequent equipment breakdowns, stockouts of drugs and consumable supplies, and lack of high-end modalities, which have resulted in medical tourism. Like our host governor told us today, he has established a diagnostic center with all the facilities. That is the main reason why people have to go abroad to avail themselves of medical service. So lack of surveillance and poor emergency preparedness is what has resulted in Ebola catching us unawares. Now, remarkably, Nigerian public health facilities can have sharp contrast depending on whom they are targeted to cater for. And therefore, if you go to certain facilities that are supposed to cater for the high and mighty in government in Abuja, you find empty seats. And in comparison, you go to a facility meant for the masses, and you find a lot of crowding, overcrowding. So you don't have judicious spread of facilities. I was privy to accredit an institution in Abuja, and we found a whole room full of brand new ultrasound equipment that they couldn't use. Not because they were not working, but because they had more than they needed, and every day more is dumped into the facility. Whereas there are thousands of hospital practices across the nation that do not have an ultrasound machine. So the barriers are certainly threatening to overwhelm the system, that even a beast, the next slide on this, even a beast of burden can be overwhelmed. Those controlling the slide, the next slide, please, so that we'll be on the same page. The happiest people don't have the best of everything. They just make the best of everything. And the pursuit of better health, as I said, should not wait for improved economy. So we come into what we need to do for preventive, protective, and innovative Medicare, the solutions. Let us join hands in this effort. We should never doubt that a small group of thoughtful, committed people can change the world. Indeed, it is the only thing that ever has changed the world. And therefore, I call on the progressive governors. I'm glad that I'm in the midst of such a group of thoughtful people that are committed to change the world, who realize that there is a need to build. And that is why I have the confidence to come up with some of the utopian suggestions that I would like to bring back. There ought to be patient redefinition of the government's role, keeping the focus on equity and accountability. We need to switch to market-based governance styles. We need to reduce the role of the 3 tiers of government. We need to have a strategic directional role for the 3 tiers of government and private sector engagement. Very, very important.